everybody. Welcome to Oncology Data Advisor. Today, October 15th, is Lobular Breast Cancer Awareness Day in Texas and Massachusetts, and there's a ceremony happening today at MD Anderson Cancer Center, as well as at other cancer centers across the state. And here today is one of our editorial board members and one of our forefront lobular breast cancer researchers, Dr. Jason Mouabbi, who's here to tell us a little bit more about this day. Thanks so much for coming on today.
Thank you for having me. I'm super excited that finally that very special subtype of breast cancer is getting the spotlight it deserves. Lobular breast cancer has been historically understudied, which is really unfair to the patient that have to face that type of disease every year in the US and the world. But finally, we're getting strong steps toward the right direction at both increasing the awareness, getting better diagnostic tools, getting better imaging, getting better treatments, and so forth. So today we are celebrating October 15 as in Texas as Lobular Breast Cancer Awareness Day. I know other states also have it as well, but this is excellent to see that finally, lobular is getting the attention it deserves. And just I'm going to say a few words about why we need to study that special subtype of breast cancer separately than other subtypes of breast cancer. So lobular breast cancer is 10 to 15% of all breast cancer, but don't let that percentage fool you. It's still pretty common. It's not a rare cancer because 10 to 15% of breast cancer means 44,000 new patients per year will unfortunately face this subtype of cancer, of breast cancer. So let's put that into perspective. What does it mean, 44,000 new cases? So if you split breast cancer into its two more common subtypes, the ductal cancer and the lobular cancer by itself becomes the sixth most prevalent cancer that a female can get in their lifetime. And if you compare it to ovarian cancer and cervical cancer, combining ovarian and cervical cancer, lobular by itself will have double the incidence of those two cancers combined. So it's not a rare cancer by any means. Now, I'm really happy that finally we have Lobular Breast Cancer Awareness Day because it's important to highlight that this is the subtype of breast cancer that tend not to present with a lump. I know one of the big myths is that all breast cancer present as a lump, but that is not true. And that's because of lobular breast cancer and inflammatory breast cancer. So let me talk about lobular breast cancer. It's very rare to present as a lump. When it presents as a lump, it's usually later on. It's usually more advanced stage. But also some cases, but this is not the common, can present with a lump early on. But usually when there is a lump, it's a more advanced stage. Imaging, conventional imaging do not work very well. It doesn't mean they don't work at all. They still work. Most of our lobular patients are still diagnosed on a screening mammogram. However, we can do much better. And we are working on doing much better, incorporating more MRIs, incorporating hopefully in the future contrast enhanced mammography and so forth. But we are trying to do better in terms of screening this special subtype of breast cancer. Also, we're trying to do better staging imaging. So when the cancer presents in a more advanced stage, having an appropriate screening for the body, such as the incorporating of this new PET scanner called FES-PET, which really look at the estrogen receptor activity in the body, can really help us better stage that cancer. In fact, there is a recent paper published in JAMA Open Network that showed that in lobular breast cancer patients, if you compare the FES-PET to conventional imaging, such as the FDG PET or a regular CAT scan, it doubles the detection rate, which is excellent to see. And finally, treatments. So I'm really happy to share that a week ago, we got the first approval, the activation of the first study for metastatic lobular breast cancer patient in the United States. And that's using an oral medication that targets specifically a mechanism that is seen in lobular and not other breast cancer. The study just got activated and we enrolled the first few patients on it. I'm really excited to have it available, but the future is bright. We also are going to be opening two more studies in the near future. One for the early setting for patients that present with tumor that are more advanced and need some sort of before surgery therapy, what we call neoadjuvant therapy. And we can open another study in the metastatic setting that involves immunotherapies. Both those studies have been approved. We have the budget for them. We're currently in the development phase, and hopefully it will be open in the next 4 to 6 months. So very exciting time. We're getting a lot of spotlight. We're getting a lot of exciting research happening for lobular breast cancer. So I want to reassure our patients and everybody that's facing this diagnosis, we're working on it day and night, and we're working relentlessly, and we're going to get to a state where we can detect it better, we can treat it better, and hopefully cure it.
Amazing. Well, I'm glad that lobular breast cancer is getting the attention it rightfully deserves on this Awareness Day. And on behalf of our audience, I'll thank you for all of you and your team's tireless efforts to help advance the field and improve outcomes for patients. It's definitely exciting to hear about all this research. So thank you so much for coming on today to help to shed light on lobular breast cancer.
Thank you for having me.